Welcome to this webinar of the Royal Anthropological Institute, which is the second one already in our series on anthropological responses to COVID-19. So this little bit of housekeeping is just to orient you in the webinar space. There's two RAI staff with you today. That's me, Haneen, and my colleague Emma.
Hi everybody, I'll be in the chat box.
Yeah, so Emma will be managing the chat box. If there's any technical questions, please write them there. So the event, the timing of the event is so that first Vanessa Grotti and Chiara Quagliariello will be giving their presentation for about half an hour, which will be followed by 15 minutes of Q&A, just about their presentation. And then we'll move on to Giovanna Guslini, and she will present her paper, and we'll have another 15 minutes about questions just for her. And then we will have about 20 minutes of general Q&A with whatever comes up in that time and what's left over in terms of questions. If there is still leftover questions at the end, because we will maybe not come to all the questions that are asked today, you can send them through to info@rai.org.uk, and I can then distribute them to the speakers, and they can see if they still want to respond to them. So what else is there to say? Let me see, I think I almost had everything. We will be recording this session today, so just be aware of that. If you type your name somewhere and you don't want it written out, read out by us, maybe just send questions in anonymously, and hopefully in some time we can put this webinar up on our YouTube channel. Yes, so I'm going to hand over finally now to our chair and the director of the RAI, David Shankland.
Well, good afternoon, everybody. If it's afternoon where you are, it's very nice to see you all. I am talking actually from the RAI building itself, and those of you who know our building will be pleased to know that it's still standing, although the streets are very, very quiet, and many of our favourite places have closed down, I assume, forever. But never mind, there are signs of life, and we're sure that things will get back to normal soon. In the meantime, though, we're going straight to our speakers, and I would like to welcome our first two who are giving their papers jointly. So Professor Grotti from the University of Bologna, who will be they'll be talking about her ERC project, which she's running from there, along with Dr. Quagliariello. And so we welcome them to the floor with some virtual applause, and we'll go to questions afterwards. Please don't hesitate to ask questions, of course, even whilst they're speaking. Thank you very much.
Thank you very much, everybody, and thank you, David. And we're very pleased and happy to be here. So I'll be sharing the PowerPoint, and I will start reading the first bits of the paper. So there we go. So our paper is called Lockdown Babies, Pregnancy and Maternity Care in the Shadow of COVID-19 in Italy. So Chiara and I are actually very pleased to have the opportunity to share this paper with you. It's very fresh, it's very new, and it's exclusively based on remote ethnographic field research, which we conducted during the 2 months of lockdown in Italy, in March and April in particular of this year. So as I'm sure you all remember, Italy was the first country in Western Europe to be affected this past winter by a devastating COVID-19 epidemic. The epidemic officially started on the 21st of February with the first diagnosed domestic cases in a few rural towns in Lombardy and Veneto regions, so of northern Italy. The first weeks of lockdown, which started nationwide really on the weekend of the 8th of March 2020, as you can see on the timeline, and then really hardened on the 10th of March, as we remember it, were indeed a time of extreme anxiety. The country was hit pretty much unprepared, and both of us had retreated to our hometowns with our families. Chiara and I have been working together, in particular on a research project called EU Border Care, so for quite a few years. It's a project that examines, in particular, pregnant crossings and hospitals and clinics in European borderlands, in particular in the Mediterranean. So in early March, we'd had to grudgingly cancel a series of research activities which included a documentary film project on kinship and traditional midwifery on the island of Lampedusa. We were scheduled to fly in on the 8th of March. So here we are in our hometowns in the midst of all these uncertainties, and of course with huge domestic care burden together with having to rearrange work schedules. Nevertheless, we sort of called each other a lot to give ourselves also comfort, and we decided to engage proactively with what was happening at the time, also to try to make sense of it as anthropologists, medical anthropologists. And I think it was also somehow a way for us to cope and to help us deal with the crisis. So from mid-March until May this year, we carried out remote interviews with working and middle-class women and their relatives about the experience of pregnancy and birth in the shadow of COVID-19 across Italy. The methods we used were quite peculiar for us because we're very much attached to the field and to fieldwork. So we hope to be able to discuss further with you all the issue of remote research for student and professional anthropologists at the time of physical and social distancing, acknowledging also the positive aspects and of course the shortcomings of these techniques, but also sort of reflecting on how these could be used to maybe relieve existing inequities in professional anthropology. Because in the end, both of us did manage to conduct a small research project at a limited cost. We collected data whilst having caring duties, homeschooling duties, and allowing us also to be flexible and adaptable from home. So I'll move on now to Chiara, who will carry on with the paper.
So how Vanessa mentioned, the methods we used were quite simple, although we did set our limits to ourselves in order to stick to ethical protocol. We decided to use one social platform and 2 accounts in order to advertise our small project and recruit participants. We chose not to use our pre-existing professional contact across the Mediterranean to reach to our pre-COVID research participants and stakeholders, such as clinicians, NGO workers, or migrant patients, because some of them in this last category can be considered to be vulnerable, and we are not sure it will be ethical to involve them in an urgent research project. After this call for participants that you can see here in the slide, several people contacted us. Most of them pointed out their interest in sharing with us their experiences of pregnancy and childbirth. More specifically, in the message we exchanged before the interviews, some of them highlighted the need to be listened to and to talk about this unexpected situation and the related contradictory feeling they were experiencing. So from the start, we had a strong emotional response to our call. In some cases, because of the limited time available for the research participants, we were struggling to combine their job with their domestic and caring duties during the lockdown. We offered them to send a questionnaire to enable respondents to fill in the answer at their own pace. We conducted the interviews via telephone or by online platform if they prefer to have the screen on and see us. Most interviews we made lasted for about 1 hour. Prior to the interview, we sent an informed consent form asking them to sign it digitally and return it to us. Following the interview, some participants introduced us to their family and friends networks so that they could be included in the research as well. This kind of snowball mechanism among research participants limited our research sample to few categories of people, largely white, heterosexual, working or middle-class couple. As you know, the COVID-19 pandemic has led to a transformation of healthcare management within a hospital setting worldwide. In Italy, although all non-urgent medical care and intervention were immediately postponed from the end of February 2020 in order to free up space and personnel to take care for the heavy influx of patients in the intensive care units, pregnant women were among the few groups who were nevertheless expected to continue engaging with available medical services, carry on with their antenatal care routine, and give birth in a wholly reconfigured clinical landscape. So how were this clinical landscape reconfigured? A short answer would be that As have been observed also elsewhere worldwide, for instance in the US, maternity care veered toward an increased medicalization at the expense of a more humane and sociable form of care. Generally speaking, Southern European nations are characterized by the tendency to medicalize pregnant women, and Italy is no exception. With the majority of births occurring in hospital and midwifery much diminished, Italy has the most higher C-section rate in Europe. The high rate of medicalization also emerged from other interventions on women's body, such as pharmacological induction of labor and episiotomy. Italy has a state-funded national healthcare system that ensures universal access to maternity care. However, its medical infrastructure reflects strong regional inequalities between affluent and well-equipped northern and central regions, such as Piedmont or Tuscany, and underfunded and vulnerable southern regions like Calabria or Sicily.
As the novel coronavirus spread, the epidemic's immediate effects on maternity care included the suspension of home visits, gradually cutting off preventative medicine and interpersonal sociability from pre- and postnatal care, and the shunting of women to larger hospitals where they faced a higher risk of infection and were left to give birth on their own without kin or community support. As a result, pregnant women experienced isolation in multiple social and material ways, from confinement at home to how they received care. The words of Anna, a 35-year-old psychologist who lives in southern Sicily, are emblematic in this regard. There should be this relationship with the belly. I'm in the 5th month of pregnancy and this relationship is missing somehow. There's this absence of the gaze of others that makes your pregnancy a social reality. Other people help you understand this process, which is unfolding. Many of the women we interviewed had a nagging feeling that space and time had started to operate differently, closing in on their everyday lives, limiting not only their physical movements through space, but also their lived reality and sense of becoming. Some participants described this feeling as if confinement had forced them back in time, several generations back, to a time when Mediterranean women's daily lives were indeed restricted to the home. This was expressed critically by Anna again, who'd made it a matter of personal emancipation to be, and I quote her, the one who breaks all the stereotypes by juggling work, activism, and social life, including during pregnancy. All of the women we spoke to stressed how they'd been living in almost complete self-isolation at home for fear of contagion, never leaving the house except for medical checkups, which they now had to attend alone. Sara, a 37-year-old public administration officer who lives in Piedmont, underlined, I never go out except for my medical appointments. And I don't see anyone, and then of course wash my hands like 1,000 times when I get home. I take my clothes off and then put them straight to wash. I haven't seen a human being in the past 20 days, except for yesterday at the hospital. And here is another quotation from Alice in Sicily. I'm nervous about going to the hospital for my next checkup. Bear in mind that I haven't left the house in almost a month, confined on my veranda, so it will be my first venture outside. Last time I was out was before the emergency, and here in Sicily, no one was wearing around masks. There wasn't this atmosphere of emergency.
Some couples we interview choose also to live segregated life if they were not both working from home. The fear of contagion led in some cases to a transformation on physical intimacy in all its aspects, such as meals, use of the bathroom, and sleeping, leading to a stringent self-isolation of pregnant women, both within and beyond the domestic space. The few outings now permitted principally involve traveling to the hospital for medical checks. There, our participant emphasized the strangeness of new forms of social interaction in the medical spaces, such as those divided between COVID and non-COVID wards, where all medical staff wore the so-called space suits. No one, including the patient in the waiting room, spoke to another, and the fear of contagion was omnipresent. One of our respondents, Beatrice, a 36-year-old psychotherapist from Veneto, noted the paradoxical pressure felt by expectant mothers to face the risk of contracting COVID-19 in hospital. I quote her, "Certainly, the confidence I had in hospital has changed, Before the epidemic arrived, I have no doubt about hospital safety, but now, every time I see a doctor for medical checkups, I am scared of getting sick. Although they no longer saw maternity wards as a safe place to give birth, both in northern and southern Italian region, all our respondents ruled out the option of home birth, especially for first pregnancies. There was an unanimous feeling of anxiety surrounding childbirth. We frequently heard fear of being forced to undergo an unwanted intervention to speed up labor and above all to be submitted to C-section. Several wondered how they would manage to breathe with a mask on during delivery, and they were terrified of being separated from their babies in case of suspected infection. All of them, in fact, have heard stories of infected mothers separated from their newborns and denied the opportunity to breastfeed, despite clear WHO guidelines citing that separation is not necessary. Marzia, a 36-year-old middle school teacher from Sicily, described the doctor-patient interaction as now less scary, which compounded her worries. I quote her, "Every time I meet a doctor, I have to wear a mask and plastic gloves. Everything is more sterile and the human dimension is lacking." Several women addressed the divergence between the expectation of childbirth and its ultimate probable reality. Costanza, a 37-year-old factory worker in Lombardy, for example, told us, "Childbirth happens a few times in lives. Honestly, I don't expect this to happen only with doctors, without partners, and with no emotional support." An additional source of anxiety, so, was the uncertainty about the possibility of their mother or partner be present during labor and delivery. Most women try to ease their fear by not thinking about and preparing for birth physically and materially. A few women in northern Italy, like Costanza, decided to transfer their obstetric care to smaller midwife-led clinics which did not have COVID wards and a higher risk of infected personnel working there. But this option, unfortunately, was unavailable for women living in southern Italy.
We're now moving on to our conclusion, so the final paragraphs. So, in every region of the country, self-confinement, lockdowns, and the suspension of physician house calls left women primarily responsible for their prenatal and postpartum care, including the decision to self-medicate or move to bottle feeding due to breastfeeding difficulties and absent lactation support. Alessia, a 40-year-old bank employee living in Umbria, still felt isolated and inadequately cared for after the birth of her first baby a month ago, despite her extensive use of online services. This was even though she regularly met family members and friends through video calls, had attended childbirth training classes via smartphone applications, shared blood test results with midwives, and received breastfeeding supervision by telephone. These realities underline women's need for a sense of community and reveal the new centrality of telemedicine in obstetric care, while also exposing the latter's limits. For non-Italians living far away from their families, so the ones we interviewed, mainly described experiencing an even greater sense of solitude as the national lockdown coincided with the closure of international borders. Additionally, their limited knowledge of the Italian healthcare system and the obstacles they encountered while trying to participate in online networks of mothers led many to be poorly prepared to meet their health needs. Finally, depending on the degree of women's access to technologies, legal and economic status, migration status, and language skills, their ability to access care and escape isolation are thus unequally and unevenly available, increasing existing inequities at the expense of women's well-being. That's it for us. So thank you very much to all of you.
Well, thank you. That was absolutely fascinating. Thank you. A beautiful, concentrated depiction of this extraordinarily important development. And so thank you so much. Obviously, a lot of questions we could ask. Perhaps you could comment first of all on the methodological implications. Did you have to change your project a lot, or can I go back a bit? When you first thought of this project, was it sketched out as a conventional one? And then after the COVID-19 started, you had to sit down and say, oh my goodness, how can we change it? How did it work out?
So at the time, we were actually working with a completely different type of people before COVID, in a sense. We were working with migrant patients, undocumented, extremely vulnerable patients who often enter international borders and cross international borders and enter Italy via the Mediterranean, for example, through very dramatic contexts of rescues at sea. We've been working in refugee camps and settings that are entirely different setting. But we had also been spending a lot of time with clinicians and doctors in a lot of hospitals. When we had to move on to this type of remote research, we thought that ethically we were not sure how we were going to be able to justify using our existing contacts with the most vulnerable research participants using these methods. I mean, this is something that could be discussed, whether there is a point. I am certain that anyway, my funder would not have approved it and would certainly not have approved it in the very quick sort of timeline that we decided to do it. We literally said, okay, let's do this. And then, okay, let's just move on to try to investigate it. So working with Italians and non-Italians who are documented in a sense made us feel like the power relation or the asymmetry in this type of data collection was made us more comfortable in a sense. This is something that was really very much a work in progress, I suppose. So if Chiara wants to add something.
Yes, actually, our idea at the beginning was also to make comparative analysis, so try to understand what is happening also in other national contexts, but it was quite complicated to address this call for participants also to other national contexts. Another element is lacking somehow in our research project is COVID positive women, for example, so we cannot reach this kind of patients and make a kind of comparative study between non-positive and positive women. So it's a work in progress, but yeah, it was quite interesting to suddenly change our methodology during the crisis.
Mm. Yes, yes. And following on from that, I mean, clearly these women, you described very well how these women felt a sense of disempowerment. It must have been very, very, very difficult, having spent generations trying to build it up. But I'm just asking myself, how necessary was this disempowerment? I mean, does it stem out of the situation of the virus itself and the health crisis? Or is it a function of a patriarchal state imposing something that was not strictly necessary? So how would you interpret the causal factors in all this?
Yes, absolutely. It's a very good point. And we did publish a piece in Italian which addressed the gender dimension of the response, the public health response, and then the political, also the decisions and responses to the crisis, which obviously negatively affected. I mean, this is not the first time that has happened with COVID. We've had it before. Epidemics that do not really do not work towards gender equity, that's certain. Mm-hmm. What is interesting is that this very extreme self-isolation was very much the decision of the women and based on fear of contagion. And it's very telling that the first patient, the first patient, the one who was diagnosed on the 21st of February in Bologna, who was a very young and fit and sporty young man who ended up being extremely sick and almost died and was in coma for about a month, had at the time his wife was 8 months pregnant. She was also positive, but she was extremely healthy and she didn't have symptoms and she went on to give birth. So there was this tension between these two patients. You always assume that the vulnerable one is going to be the pregnant woman, and in this case it was the other way around. So it's something that needs further to be investigated further, and I think that would really require, and these are the limits of this type of research, because when we started, we could not really access the medical, even through our medical contacts that we had, because everybody was so busy in the hospitals. They just did not have time to the luxury to give us an hour of their time. And then, of course, the positive patients as well. So this is something that's obviously missing from this.
Yeah. Yeah.
May I add something?
Please.
I think we have to make a distinction between the domestic situation, where we can speak about a step back about gender relationship in Italy. And another element is medicalization, because actually also before the crisis occurred, in Italy we have this tendency to hyper-medicalize actually pregnancy and childbirth. There is a big debate about obstetrical violence and etc. So I think that from the medical point of view, this crisis is also something that emphasizes and amplifies somehow a phenomenon that was still there.
Yes, yes, I see. But just to be a little bit more specific though, could the state have done something different in the way that they imposed this lockdown vis-a-vis pregnant women? Was there an alternative?
But something that's discussed now is in particular in the light of the second wave, and it doesn't just concern pregnant women, but it concerns any type of vulnerable patient, is a redeployment of home assistance to also to prevent people from going to the hospital for other issues, to in a sense follow them up and also not clog the A&Es. So yes, there could have been this idea of a diffused healthcare, of focusing more on a sort of the community level, instead of this form of retreating towards the larger infrastructures, the larger hospitals. And this was very much what these women said, that they would much rather not have to give birth in a large hospital that has a COVID ward. They would rather not have to go through all these extensive triage processes that the hospitals have now, with 2 separate entrances, even for pregnant women, the positives and the non-positives. So yes, rethinking how it was extremely easy to cut the assistance at home, but even in the sense of the level of the GP practices. And I think that's not just Italy. I think it's something that a lot of countries have experienced, just retreating onto the hospital and cutting off the human side of this care. And I think one solution that quite a few women found was to turn to their local what are called consultorio, so they're local tiny little clinics that would provide maybe more care, where they wouldn't want to go on a normal pre-COVID, but then they would turn to these local community care spaces where they could be in contact and in touch with midwives if these were, but these are sort of a luxury that you cannot necessarily find everywhere as well. So this is about funding as well, and how cuts have impacted on the healthcare system at large.
I see. Thank you. Well, perhaps I should just begin here with some questions here. There is a practical one from Mary Greenfield, and she said, "Would you please inform us how many interviews you conducted and how many surveys?"
Chiara, you want to?
Yeah, we interview around 20 people, and it was quite long interview, and we also follow these people during the pregnancy and childbirth experience. Let's say that the first interview was during the pregnancy, and then we also have a second interview after childbirth. So we can follow these clinic stories and women's stories before and after the moment of the birth. So it was our methodology. Right.
Very good. Well, that's a good lot.
And also, I want to add that in some cases we interview couples. That's meaning that we have the women voice and also the men one. So it was interesting also to listen to the father that cannot attend the moment of birth, and also this rethinking of gender balance in the moment of birth, with this also the men experience on this subject.
Right, I see. Well, that brings us to a question from Eva Maria, and she says, did you also talk to the medical staff about their experiences?
Yes, so I can answer that. No, as I said before, not for this one. We did reach out to some, but they were too busy to answer. So it would be a really, in a sense, this can develop into a longer project where you work on a sort of oral history or looking back at what the experiences have been. What was interesting as well was finishing off from Chiara's comment as well, is that when we started, we had no idea what was actually going on in the hospitals or in the maternity wards. So we learned a lot. So in a sense, the women in particular that we interviewed, it's a bit like as if they were doing fieldwork for us, because we were so used to spending time in hospitals or in the field. It was really weird not to have this sight or this sensorial experience of being there. And it was just, we're very hungry for detail. And then we sort of really wanted to know visually as well what places were like. So we were really trying to focus on just to try to get a sense of what the experience is like, as much because we didn't have it. And it was very frustrating. And bit by bit, we understood the types. It was extremely exploratory. At the beginning, we just started contacting people, and then we worked out some questions from the answers we got, the things we didn't know. And yeah, it was just that kind of research. We did a bit of internet search, sort of trying to see whether there'd been publications or sort of general articles, but there was just nothing, even in the news, in the media. It was extremely positive. So it was all about how amazing it is that women can still give birth, and the midwives are very nice to them, and they were very happy. There wasn't much actually substance there. So it was very weird to try to get all this experience of fieldwork through the words and through the eyes of the women we were interviewing. But that again, it would have been extremely so important to have that medical element. And we work a lot with doctors, but on for this project, no, that didn't happen.
That's fascinating. And there's a question here from Bülent, and he says that he's also heard about people dying in solitude. That is, that they're burying their loved ones without being able to be with them. And so I suppose the question is are you seeing a pattern here of dehumanization and detachment from normal rituals? What do you think?
Yes, absolutely. It's connected. I think it's just this cutting of kinship. People who are at birth and death, and I think it's going to be a lot about reflecting about the trauma as well of these moments, and the return to life as well in these contexts. For the mourning process, that is just so unusual. The images that, I don't know whether you've all seen the images, in particular of Lombardy region, where the army had to come in because there were just so many dead. They didn't know how to, they had to call in the army to be able to take the coffins away. And there were images that were extremely traumatic, and the soundscapes as well of the ambulances that never stopped. For example, in places like Milan were extremely traumatic for people. So there's a lot to be reflecting on. How do you know now people can return to cemeteries? Now it's going to be a long process. So it's interesting because we've been working on death and in migrant death at sea. So it's in a completely different context, but certainly, yes, the whole ritual element has been transformed, and also it's not just, I think, with the women in Italy, where in particular in southern Italy, where the presence of the family even during birth and then immediately afterwards is so important, and they were saying it's such a celebration, and you have to go through the stages where normally your mother is present as well, and then immediately when you come home all the relatives come in. And being deprived of that was even harder in a sense. And that was a sense of solitude that I really felt.
Yes, thank you. And there's a question here from Natalie, and she says, were any of your subjects affected pregnant migrants? And she said, did you see any examples of medicalized racism or xenophobia? Or were there any strategies to counter this kind of thing?
Okay. So in this specific project, we didn't have the opportunity to explore this subject in deep, but in our normal, let's say, project, we work with sub-Saharan Black migrant women, and we work a lot about obstetric racism, let's say, or racialization. These women live in the medical service in Italy, especially for medicalization or under medicalization, according to health professionals. In both cases related to some stereotypes or racial imaginary that in this moment are circulating not only in Italy.
Yes. Would you like to add anything to that point?
We did interview some non-Italians, some migrants, but white, and who did feel, as I said, feel even more isolated, and I think really felt very strongly the fact that they felt trapped in a country that was not their own, in a sense, that they could not go back. For some of them, there was this sense, and not feeling very much at ease with the whole change of atmosphere within the healthcare because of the coronavirus emergency. That is, how everything is just very sped up, or the visits don't last very long. For example, the postnatal checkups, and it was just sort of felt like a very stressful experience in a sense. But we again, I think this is something that could be interesting to be developed further and to think about and to discuss, even as a professional organization, as professional anthropologists. How do we work on with, for example, undocumented patients in these contexts? I'm not sure I would feel at ease to be interviewing, collecting data, not just because of the power hierarchy involved. I'm extracting data from you and I'm not even meeting you. It's just also about how do you share and talk about more sensitive and potentially legally sensitive, or how do you guarantee the protection of your informants if they are vulnerable in these contexts? I feel like there's just so much that could be slippery or out of our hands. Already it just feels so difficult and alienating to not be conducting fieldwork physically, and so that's just something that's very new. And I think in a sense, we were so caught up as well in our everyday lives with the homeschooling and the other work duties. We just did what we could in the time that we had, and which was, we were pretty much, it still was quite a lot. But I think in a sense, I really wonder whether we would be, I feel like there's a sense of closure now that the lockdown's finished. We feel like we've completed a little project in itself. And we did what we wanted, and I'm not sure how we would explore it further, but it would be very interesting to be able to see maybe, further with connecting with other researchers in other countries. I think that would be the best way to go forward.
Yes, yes. Could I just ask you, presumably if fieldwork becomes virtual, then all of your interviews are automatically recorded. And so you get the ethical question of what do you do with all this? Because of course, most of the stuff that we do in a normal fieldwork situation. I don't know, what do you think about that?
Yeah, this was an issue that we treated at the beginning of our interaction with the participants. So there was a first moment prior to the interview, so we agree about the modality of the interview, and some people want to be recorded, others not. So if they're not, obviously we didn't record. And when we use online platform, it was possible to record the interview. So they agree about this, and they always, as I said before, we send to them in informed consent form, and they will specify also the kind of interview we can make with them. So everything was quite clear from the beginning. Yeah.
Yes, that's very interesting, because one of the things that the research councils are doing in this country, that is the UK, is they are insisting that all fieldwork data be made available to the Research Council. So this is what was at the back of my mind. Nothing's confidential anymore, nothing at all.
I think you cut off a bit, but I think we understood. Yes, this is something that's also, in a sense, that is also why we decided to work with people who documented patients and their relatives in this context.
Okay.
And
yeah. I see now. Yeah. Yeah.
With the funding, with our current funding bodies, we came to an agreement that no, we do not have the obligation to share everything online. So we can retain our data, but certainly this is a huge issue that will have to be addressed more and more in the coming months, but also years, I think. And I feel a lot for the younger sort of generation, the students as well, who will have to grapple with a lot of legal terminology in the research. Not so that's certain.
Yes, indeed. Well, we're also grappling with it. I don't think we've got any answers yet, but I'm sure you can help us in the future. And there's Yulen would like a follow-up question to his earlier question to do with loneliness. He says he wonders whether the fact that childcare is by definition something which is so much of an embodied process. He was wondering whether that in turn relates it to it becoming very ritualized. And so there may be a connection between social ritualization and embodiment. What do you think?
Let's say that maybe we can find in this moment also new kind of rituals, because people have to face this unusual situation. So for example, mother used to share a photo of the babies with grandmother and etc. So they try to invent somehow new form of sociality around childbirth and etc. So let's say that people cope with this situation, and obviously you cannot find the same kind of rituality that you can have during normal time, but new forms of ritual are emerging, in my opinion.
Yes, so that's also absolutely fascinating, and that really links into a question asked here by Alice Amber when she's wondering whether there might be, in fact, a positive side to all this, that mothers and their newly born children can spend longer with each other without being interrupted. I don't know whether any mother mentioned that at all.
Yeah, it was amazing because actually there was this contrasting feeling, almost quite all women underlined during the interviews. On the one hand, the fact that they feel isolated and they cannot share this experience with other relatives, etc. And the other hand, this unique and lucky moment of their life that they can spend with their partner and with the baby 24 hours per day. So it's an impossible situation to be reproduced somehow in their life. So there was this kind of thing, okay, if I reflect one moment, I will never be pregnant during a health crisis, but at the end of the day, it was also a way to fully live this experience in a way that I cannot imagine anymore. So it was this contrast feeling that emerged from our interviews very often.
Yes, I think there was sort of a class dimension as well, because those who could afford the couples who could afford to stay home because they felt this connection, but there was also the sense that the more working class couples, or when the partner will have to go out to work, there was more of a sense that even during the pregnancy they couldn't bond as much. In some cases, and there was the worry of contagion as well, depending on the job of the partner. But it's certain that there was all these special coping mechanisms that were these little strategies and these little rituals that they seem to have all developed, even just daily habits and little ways of dealing with this and creating a special time. And I wonder now that the lockdown's over, has been over for a while, how they've been coping with going back to a new type of sociality and with relatives. How that's because we haven't interviewed anybody since mid-May.
Yes, and there's a question here. From Lali Yalchin, and she asks, did anybody talk about having close kin becoming more important during isolation? Did it change kinship networks and their relationships at all?
I think the relationship with the mother, the relationship of the pregnant woman with her mother was cut off in a sense, and whereas the one with the partner, so with affinity in a sense, was really reinforced with the close partner. And then that sort of seems, because the importance of the mother who participates in the pregnancy, who is the one who often getting all the clothes and preparing, doing the food shopping and just basically being very invading, was just completely cut off. And there was a new way, a new form of relationship, I think, that emerged more sort of horizontally in a sense with the partner. That emerged. And what's interesting is that the older the generation having the children describe themselves as being the reasonable ones, and they were sort of trying to push away the older generation who kept wanting to come and visit. They said we will have to find out strategies to stop them from coming to visit because they're dangerous and we can't control them because who knows where they go, because they're the ones who are in Italy. Everybody was sort of joking about how they would abscond to go to the bar or play cards with their friends. And there was this idea that they're not the reasonable ones. And so that was an interesting thing that emerged. Chiara, do you have anything?
Yeah, also a lot of women try to cope via social networks. So this horizontality is also among women themselves, like exchange ideas or some advertise or advice among them. So there was also this new form of sociability that emerged a lot during the lockdown. So a lot of WhatsApp group of women that were together during the training classes for childbirth, and these training classes would just stop it, and they continued speaking each other and then asking some information to the midwife and etc. So I think that the family role changed a lot, but people also try to find other actors to share their doubt and the anxiety in a kind of horizontal way.
Yes, thank you. I can see that we're very nearly out of time, but do you just want to give us a comment on where you think this research might go? I heard you say earlier that you think it might be self-contained, but it seems to me there are lots of things that could be taken further. You couldn't give us a final speculation as to where it might be taken?
We've got, it just feels that a lot of the unfinished projects pre-emergency are piling up, and I think this is something that we've all been feeling alarmingly. And we have some projects that we were very attached to. For example, we mentioned the documentary film that we feel, and in a sense, we're trying to find a window of time where we could be actually traveling to places like Lampedusa, where we're going to interview elderly women. So then through that, there will be opportunities to reinvestigate these questions. But I think, yes, it will definitely be branching and meeting up, as we'll be developing, returning to our previous project. We will always be addressing, because I think this emergency is not going away for quite some time, and it will be taking over most of our lives in the coming years. So we will then be approaching again other types of informants, maybe a bit more vulnerable, but then obviously, hopefully through a different method where we're not sure. I think we all reached as well a certain level of Zoom fatigue, and sort of, we'd like to return to more human contacts. I don't know about you.
Well, that would be very nice. I agree. Well, thank you so much. That was extraordinarily enlightening, and we're very grateful to you. So now we turn to our final speaker for today, Professor Guslini, who is going to discuss how the COVID-19 crisis has had all sorts of unpredictable responses, not all of them bad. And so we turn to the paper, Distance Learning in Italy During the COVID-19 Emergency, an Unwanted but Healthy Leap Forward for the Future of Education. So thank you very much, and we turn now to our final speaker.
Welcome to everybody, and thank you for joining this seminar. I will share my screen, and I wanted to show some PowerPoint. The paper is about the distance learning in Italy during the COVID-19. It is an unwanted but healthy leap forward for the future of education. This is my hypothesis and the thesis I will show in this paper. And but I wanted to check with a focus group what was going on in a deeper way. The paper is divided in 3 parts. Part 1, a quick overview of the use of distance learning technologies in Italy before the big leap. The part 2, schools in Italy try to evade the lockdown. How could they do it? Part 3, after the jump, what can we save of this experience? In this quick overview of the use of distance learning technologies in Italy before the big leap, we will see what is the National Digital School Plan, where technology were already used before, before the lockdown, and what did e-twinning do before this crisis and inside the European and international projects. The National Digital School Plan is a multi-year path of innovation and digitalization that started in 2016 and is still ongoing on. It was promoted by the Minister of Education, University and Research in synergy with the European Programming Education, PON Education 2014-2020, and the National Strategic Project for Ultra Broadband. In total, 1 billion euros were invested for 35 actions. Educational institutions had to prepare a 3-year plan, their 3-year plan of the educational offer, and they had to put in this plan the actions consistent with the aims, principles, and instruments of the plan. They had to adopt the constructive and cooperative didactic methods and introducing the figure of the digital animator, and take care of the importance of initial and in-service training of school staff. Technologies were used also in the last 20 years for isolated environments, for special needs. And here you can see some classes and some school plexuses in Cornation in an area, isolated area in the mountains of, on the mountains of Matera, in the Basilicata region, south of Italy. And they are trying to overcome the digital divide thanks to experimental project within technologies. This experimental project is also for the schools in hospital, and here is the, another example of the classes in hospital with one class that is the name of the experimental project in Basilicata. Here you can find, you can see the student with 2 teachers and the class connected with her. Also, technologies were very important and very spread in inclusion via web, and they were used for special needs. And there is also a big project of the Minister of Education for this. Another project, this is the last of our overview in the first part, is e-twinning and the European International Project. E-twinning is a big project starting from the European the EU, and it was one of the biggest projects for which I had to work for about 10 years when I worked for the Ministry of Education. I think it was the best project I could follow, and in which I could give some competencies of anthropological competencies that I could also check in my researches abroad. The Italian statistics say that teachers, schools and projects involved in this European community are a big number. If you compare the number of teachers, 81,000 teachers, and in Europe, 814,000 teachers, you can see that it's a big number in Italy. If you consider that there are about 36 countries involved in the project. The same also you can tell about the projects activated, 29,000, more than 29,000 projects, and in Europe there are 106,000 projects. So there was a lot. There was there were already many projects about technologies ongoing in Italy, and a twinning was created in 2005, and that was the year when I began to work for it. And it was an initiative of the European Commission, and it is still currently one of the actions of Erasmus+. It has a platform, an IT platform, and people can register in it and work inside it. The second part tries to understand what schools in Italy did for evading the lockdown. Yes, it was possible in some way to evade the lockdown. And we see some experiences in Lombardy with the twinning. We will see who could answer the SOS distance learning. And then I want to show in a deeper way a focus group I made in Liguria region, the region where now I am living. I was working in Lombardy for many years in the Ministry of Education, General Director of Lombardy, but now I live in Liguria region, and I wanted to deepen what happened after I left that project. And so the focus group was very important to me to understand this changements, what changed in the meantime. We could understand, we could see also many inequalities in social, during this lockdown. The distant learning experience with the twinning began with a transnational collaboration at the time of COVID-19 in a primary school in Lombardy. This is the experience of Luisa Lenta from Codogno. And Codogno, as we said in the first presentation, Codogno is a little town. It was the epicenter, the first red zone of COVID-19. The project is the red zone, isolated but connected. This was a new project of this school, and the teacher says, before mid-February 2020, no one could indicate on a map of Italy where Codogno is. No one had ever heard the name of it, and no wonder. Codogno is just one of the many small towns about 50 kilometers south of Milan, and where the inhabitants know each other. This anonymity did not last for long. on Friday 21st, February 2020, just before the carnival holidays, Codogno's daily life was shaken by the arrival of COVID-19. Suddenly and very unwillfully, Codogno became the epicenter of the outbreak, inheriting notoriety that make it famous, not only in Italy, but also in Europe beyond. These are the manifestations of affection from all over Europe. So we can understand that the class of this teacher was not isolated at all. She says, the teacher says, since the beginning, we have received messages, email, calls, WhatsApp messages, drawing, songs, video, and all partners were stayed beside us. And she said, we needed to keep our school style active and connected. What does she mean? What does this mean for this teacher? She says, it is based, this style, our style is based on creativity, collaboration, connections, share emotions, feelings, co-build lessons, learning maths through movement, daily life events, and positive attitude. And these are the examples of some works done with the partners. The Garden of the Heart, and this is the Garden of the Heart, and there were many exchanges about the experiences of students and the other students from other countries of Europe, and the Geco Garden. The Geco Garden made with some recycled materials. Families played an essential role in helping the teachers. And here you can see the famous rainbow that started from this area and was spread everywhere in Italy and in other countries. It was the hope of young people, of students. Everything will be all right. And online lessons and feedbacks continued in this period. And also a math site was set up in moltiplicazione.it. So we can say that there are many opportunities with twinning. First of all, the collaboration and the exchange of ideas in a multilingual and multicultural space. A safe workspace called Twin Space, where activities can be set up and carried out. There is innovation, the use of technologies in teaching for the shared creation of multicultural educational projects. Distance collaboration between teachers and direct involvement of students. We can say that the twinning national unity was perhaps, I think, I'm sure, because I worked for this project for many, many years. So I'm sure that the twinning national unity in Florence, that works beside the Ministry of Education, answered for as a first institution to the SOS distant learning. And she answered together with 36 countries, the network of national unities, twinning national units, and also with the help of the European Central Unit. So maybe what began during COVID was spread afterwards in all the network of national units. There was also another big from many networks, and the motto was the school doesn't stop, the school for the school. So you can see in this picture network of schools represented by head teachers that want to spread the word about innovative teaching systems. Now the focus group. I can tell you what I wanted to check, because it was not necessary to collect many data about this. That was the work I have still always done, and it is we can see many data about this now in the portal, in the platform, the European platform, and also in the Italian website about e-twinning. In La Spezia, the area where I live, in Liguria region, I wanted to interview some people that were close to me, and people of different ages, different roles, teachers, parents, students, different schools. And they were a private school, starting from a private school of painting, ceramics and comics, attended by students of all ages, from maybe 15 to 80 years old. It's a sort of lifelong learning. And also people coming from a state primary school and a state secondary school. One of these teachers told me about this interesting experience. A laboratory teaching called Distanziarte. Distanziarte means art from distance. And it's a project made in the third class of a primary school. At the beginning was related to the historical artistic field, beginning the laboratory from the figure of Venus, the Venus of Willendorf. But we can see that the project became an interdisciplinary project with the technology, design and concrete realization, logic, time and materials management, geography, knowledge of materials, origin of limestone, deductive thinking, Italian language, and so on. Francesca Battini is the teacher, and she explained to me that there was a lot of interactivity also. The students had to say yes, we can go on. I am curious. Or I need some other info. Oh no, stop! No, I have not understood. Why are we speaking about this little statue? And here is the result of the laboratory. It was inspired by the works of the artist Arnaud Nazar-Aga, a French artist living in Thailand. And the student modeled with clay and then painted the Venus as in the style of that artist. Here you see the front and the back of the Venus reproduced by the student. The teacher said, Francesca Battini, we felt the need to leave the school, and the knowledge it transmits as a continuum with the reality we face every day. She spoke about reality tasks, and the final part of this workshop has seen the correlation between Paleolithic sculpture and the current representation with contemporary authors. The children had the opportunity to deepen also the social and historical role of women, and they experimented materials and new authors. And finally, they placed historically in imaginary timeline the works they made. There is another laboratory, the virtual walk between liberty and futurism. This is a futurist dish. This is the result of the laboratory. Mezzi tocchetti, that means pieces of pasta, crazy pasta on the wave on a sea of blue spaghetti. There is a lot of fantasy, but it's normal because Elisa, primary school in La Spezia, was studying in that laboratory also the Marinetti, a futurist artist, the Marinetti's dish presented as an example to children to make them understand the particularity of plating. And this is the way, fantastic way, the creative way the artist represented the plate. And then the student could see the historical shop in La Spezia in Garibaldi Square. Outside the grocery, they displayed in pastime a futurist painting that caused a stir. So the laboratory was tied also to a virtual tour in their town. The focus group showed me lights and shadows. So I find out some things I detected in past times in the project I could follow. Shadows, of course, are everybody was unprepared for the jump. We were not prepared nationally for such a leap, disorientation, disorganization in the early days. Then individual teacher initiatives came, do it yourself. But burnout was very frequent. And the families were not equipped at all. For the little ones, for example, too much work was entrusted to the families, who often did not have adequate devices and had a limited connection. There were some faults and some cunning, a few sly and ambushed among teachers and students. Yes, it happened also this. But of course, the school, fortunately, called back these few teachers and students that thought to begin a vacation. Sometimes there were inadequate evaluations. They were not agreed. In video lessons, some students in the focus group told me were active, above all, the most skilled students. Senior teachers, senior teaching staff did not believe in distance learning, and students underlined also the lack of socialization, and many families, mothers told about the lack of human contact for the little ones, because the lessons, distance lessons, were too quick for them. But fortunately, there were also some lights. Some teachers told me that the situation sometimes appeared turned upside down. The distracted and the disinterested in presence have often become good distant participants. Digital skills that did not come up during the class were discovered. One mother said many teachers have reinvented themselves. The didactics has been restructured with the reality tasks. There was a spontaneous interdisciplinarity and more space for students' protagonism. There was also an increased availability to the individual. But if we see the last the survey of the agency, national agency of for the guarantee of communication, 3 days ago in this publication we saw that the situation is even worse. The coronavirus has accentuated the inequalities in Italy. The richest families have withstood the impact better. The poor ones are still suffering, and they pay a very high price. This is the survey made on a representative sample of households, and 10 out of 100 young people were completely excluded from the educational process. 0 lessons, 0 homework, no form of guided learning. But fortunately 70 out of 100 could follow the lessons regularly, and 20 out of 100 only from time to time. And we are arriving at the end. The last part, after the jump, we what we can save, what to save. I asked this question during the focus group, and they said that yes, there are opportunities, for example, in connections in remedial schools subject carried out remotely by teachers, avoiding travels and so on. And some advices should be collective for a more efficient organization. Set time for connections, do not confuse work and private life, prevent cyberbullying and so on. And here is what the solution that the art teacher found after opening her laboratory in La Spezia. This is the laboratory in presence, but she wanted to connect present and the distance together. And these are 2 people showing they are in Skype, their works in a distance and the presence lesson. This teacher, Raffaella Gragnano, mother and painting teacher at Solo Arte School, said, I'd save some things, human contact, often lacking in classroom in presence, the individualization of the didactic paths, teachers' ability to reinvent themselves, the idea that technology is not only a game. And this is the final test of applied technology of a student Mattia Grando from a secondary school in La Spezia, technical study of a bookcase. He was very proud because his teacher with WhatsApp had the possibility to keep a very good contact with him. So the individualization of the work was one of the best results for him. What has changed in the role of teacher? The teacher has become a learning facilitator, a collaborator, a guide, the one who offers more options and responsibilities in the learning process. What has changed in the student role? He is an active participant he has become an active participant sometimes, not often, of course, in the learning process. He who produces and shares knowledge. He who learns in collaboration with others. And we can say that the technologies are like a window open in front of the world. And this is my message, my final message. What a legacy from the new coronavirus. In the emergency period, the unintended, dramatic, revolutionary and instructive experiences together, that leap for which many schools were not prepared, will surely leave a legacy, a more innovative teaching and learning, and education more open, and an education more open and closer to young people. But they will also leave a difficult and perhaps impossible task bridging digital inequalities so as not to leave anyone behind. Thank you.
Well, thank you very much. That was absolutely fascinating. And of course, many of us who have been looking at the situation of teachers and pupils in other countries will also gain an awful lot of food for thought from your presentation. So thank you so much. Could I just ask you one thing just to start off? There were a couple of things really. Clearly, this was taking place right in the middle of the lockdown. When you're in your focus group, did they talk about stress at all? Or was that somehow or other forgotten in the excitement of doing online education?
Yes, in the focus group, the main questions were, what do you think are the positive results of distance learning? What are the negative results, the negative aspects of distance learning? And what would you save? So three simple answers. And during the second one, simple answer that could allow people telling all they thought about their experience. And many of them, of course, spoke about the shadows, the difficulties they could encounter in this experience. For example, some students told about the unequal way of assessing the work, or sometimes he said after they the authorities told in a certain way that everybody could be promoted. Some students stayed, didn't want to work anymore, or they were absent during the conferences online, and so we found out some difficulties according to the point of view of students, but also the point of view of teachers. Of course, the distance work, the distance learning is very useful, and the Ministry of Education and many authorities worked in synergy to improve the use of technologies in schools. I could follow this development and these tentatives for about 15 years. So it was important to train schools in technologies, but no one thought that the technologies could replace totally the presence. So of course, all the teachers, and I agree completely with them, think that the teaching and learning in presence is very, very important, but it must not exclude distance learning, and distance learning must not exclude, like in the lockdown, completely the work in presence. In my view, and in the view of many teachers and also students, above all in secondary school, the two ways of working together can go on in a parallel way.
So what will be permanent, do you think, I understand the general idea of legacies, but practically speaking, what will be the what might actually change with regard to the school life? Do you think it's possible that students will spend 1 day a week at home in future? Is that kind of radical change even possible to think about?
I think that we can cancel completely this experience, as we cannot cancel many other experiences in, for example, in the environment domain, or in many other things that changed our life. We didn't want to change so quickly, but change can be useful if it is done step by step. So my first reflection when schools were closed, completely closed, and when they had to, they were compelled to use technologies, I said, oh, coronavirus is doing a perfect work. We never could dream to do to improve technologies in schools. So we did a lot of work, but the work in national plans and in a training in the national digital plan went continued slowly and step by step. There were some people refusing to change, also in training teachers or training at the teachers and so on. I remember in 1999, I made with inside the Ministry of Education one of the first training courses for distance training courses. There was a little presence also for initial training of teachers. And it was difficult to introduce this. So now people were obliged. That does not mean that it was a nice, a very good experience, but we can take something good out of this, and we can try to plan in a different way our teaching, our learning, and so on. This is my idea.
Yes, and Emma has a question. She would like to ask you what advice you would have for people doing remote teaching today, in particular, I suppose, the remote teaching of anthropology, to try to encourage students who are having remote learning to do non-screen-based work. So how can you get people off the screen, even though there is remote learning going on?
So I don't understand. Please, can you repeat?
Yes, the question is the kind of activity that you can encourage when you're doing remote teaching. So some of it will be screen-based, just looking at the computer. But other things appear to be more practically based.
Yeah,
How do you build on that?
I think that the example of the a twinning project and the example of the project made in La Spezia by Francesca Battini and her colleagues allowed the students not to stay too much time, above all the younger students, pupils of primary school, and some students also of kindergarten cannot stay too long time in front of a screen. So it's what was suggested to teachers and the teachers was to promote remotely teaching way in which we give a very quick prompts and info to the students so that it can deepen alone, but it can also take some actions, like the students of a primary school that made their own garden, and it was inside the didactic proposal of the teacher. So the students can work, and there is a didactic can be considered upside down. So before the students had to stay a long time in class and listen to the lessons, and sometimes there were also laboratories there, but the homeworks were different. And now the homework is becoming a research, a laboratory made at home by the students themselves. They can research, browse in internet, but everything that must be must have the guidelines of the teachers. We cannot let students alone in front of the screen. So we suggested to do very short lessons, giving all the instruments to work alone or with the family or in connection with other students. But it was important also to consider that students have to be active, and so the didactic must be not only in front of the screen. So also Zoom or Skype and all these distance instruments can be used in a traditional way, like a radio broadcast, and that's enough. But you can do a laboratory with the same means. So teachers must be trained to work in this different way. And reality tasks, as the teacher from La Spezia said, are a good way to change the didactic and involve students.
Thank you. Yes. Well, obviously, it's had a deep impact, not just upon the families, but also on the teachers and their careers. But now we bring everybody together for the last part of our seminar, and we have any questions to all three of our speakers, please. And I kind of have one to begin with, which is this old question about the relationship between virtual ritual and sociality and real life physical sociality, because surely one cannot replace the other in any straightforward way, or can it? I mean, have we any evidence that virtual rituals are just as good as old-fashioned physical rituals? What do you think?
Yeah, so I think in the case of the pregnant women we interviewed, the lack of the physical embodied preparation of the body, for example, the complete dissociation between the growth of the baby and the transformations that the body was undergoing in the confinement really of the home, and then the type of training that become quite abstract, the preparation for birth. We really felt that there was this disconnect, because and that was irreplaceable, and that was something that was really taken away from them, that you cannot prepare, I mean, you cannot replace this, because so much is about the movement of the body, the movement through space, the way it interacts with others, the power of the touch, the presence of others. And this is something that that's completely irreplaceable. And that we found, what I thought that was very striking, was how much the pregnant women, especially in their first pregnancies, were not really trying to think about the birth. They were not preparing for it, in a sense, because that was a place of otherness and sort of that they felt that they could not really control, because they couldn't really prepare physically. There was no replacement. The online classes were just giving abstract knowledge that was not helping for such transformative moments. And I think when it comes to the funerals or mourning as well, the powerful disconnect, cutting away so much, not being able to be present and cry together, that cannot be replaced either. And that showed that there was this brutality of the cut, I think, here in terms of sociality, but in particular sociable relations.
Yes. What do you think, Chiara?
I just want to add something. It's also true for the postnatal moments, actually, because a lot of women underline the difficulty in breastfeeding. This is a huge issue that we can also find before, the health crisis. But it's true that midwife try to set up a digital network to help these women to breastfeed, but still women feel quite isolated, and also the methods midwives show through the video or via WhatsApp or other digital support were not so useful for these women. Actually, this embodied experience of difficulty in breastfeeding cannot be overcome through these digital and telemedicine methods. So it's interesting if we can somehow use these new methods in doctor-patient interaction, but we cannot consider this method as enough to help people when they have difficulty before and after the birth, for example.
I see, yes, thank you. What do you think, Giovanna? Do you think that virtual education can ever replace physical education?
No, I don't think so. I don't think so. I always have given a big importance to distance learning, but I think it can give an added value, very important added value to education. Can speed up some problems in schools. For example, one mother told me about the remedial in some subject, and also one teacher of a secondary school told me the remedial in some subjects can be more individual, can be done also from distance, but some you cannot replace totally. And even if when I followed some national or regional projects in e-learning, I found out that it was anyway very important to have some moments of presence. So it was a mixed way, blended, they called it a blended way to teach and learn. But the presence is very important for socialization, but as you have seen in the experiences of a twinning, I found out that in a twinning, the socialization is very, very high, and the teachers and the students share projects, share experiences, talk to each other. Some friendships were born from a twinning, but there were also some moments, after, for example, 1 year or 6 months of training schools together, sometimes the schools decided to host people coming from another country, hosting families. So it was important also the presence, and so I think the intersection of the two can be very, very useful. If you can one of the other, you may have a problems, because it's right. Not only people, women that must deliver can have problems if they cannot get in touch with other people, with other women and so on. But also some students, for example, students with special needs sometimes need to be close to the teacher and other people in the school. And also the peer education can be done in presence, sometimes also by distance. But I find out also that this experience is very good for an intergenerational development of the school projects, because families and old people working beside the young people can be an enrichment. And I experienced myself when I was I used to be teacher in the early years in a secondary school. I both in Italy and abroad. And when some students, I remember I had one student who was very negative in Italian and history. When we made a laboratory about the Japan experience, and we made a CD-ROM, I don't remember, an hypertext together, he was the only one who can help me in a splendid way, a wonderful way. And I learned a lot from him and other students very skilled in technologies. So in that moment, I have understood that the school must be a laboratory, as we said at the end of my presentation, must be a laboratory where we can build together the experiences. And I find out that the role of teacher is the same as must be, for, in my view, the same as a filmmaker that puts together many people, many occasions, many environments, many instruments, and that's what we can do now with the internet and with all the instruments of technologies.
But what about the common theme that was going through all your papers, that the existing inequalities become greater, become exacerbated? What can we do about this? Because it's clearly terribly important going forward when one thinks of all the excluded groups and so on. But Chiara, would you like to start?
Yeah, I completely agree with you, because I think we must be very careful speaking about this kind of replacement of physical to digital interaction, because there is this serious risk to increase inequalities, social inequalities. So first of all, the unequal access to technology is a reality in Italy, so we cannot consider this. And secondly, the language issue, because if we speak about Italian native children or women, okay, maybe these people can follow the instruction of midwife, of teacher, and etc. But if we speak about not Italian people, I'm not sure it's a good compromise, this moving through digital platform. For example, you can also have conflicts among generations, the same family. I'm thinking about migrant family. So you can have a second generation that is perfectly Italian speaker, but a first generation that can have some difficulty also in learning process with children at home. And also, speaking about medical staff, so midwife giving training course via telemedicine, also there the only language is Italian. And actually, if you can have formal or also informal system of translation within the medical setting, because also a lot of doctors try to cope with this when we have a foreigner patients there to informal way of translation. You cannot have this when you have virtual interaction. So I think we must be very careful not to be so enthusiastic, I mean, about this transition, because there is also some social inequality danger there.
Thank you. And what do you think, Vanessa, about this?
Yes, absolutely. I think existing inequities were just aggravated by the crisis. So we looked specifically at maternity, but I think we can look in other areas. And I think also the over-reliance on digital tools, you know, especially now at the stage when we're returning to easing out of lockdown. What happens? How do we relearn to interact with people, feeling that they're safe again? It's safe to interact. It's actually a huge process. And I think from what I've heard from my own family and stories from other children in classrooms, it is actually very hard. The older teenagers in particular, not just the younger ones, but there's a group of older teenagers who are the ones who are spending the most time interacting outside, socializing, are finding it the hardest to go back, to leave their room, to get out in outside and interact. So I think again, there will be a whole process of return to life, and this will be a gradual process for all, and we'll see it in different countries at different stages. So it will be very interesting to be able to compare and share. But the inequity is huge. Even families who can afford a connection to the internet or have access to one or two devices, maybe the parents are busy working or cannot have the patience to follow, is just extremely difficult for most.
Yes. And what do you think, Giovanna? Because you were talking about access to laptops, of course, because you can't do remote education without an access to a laptop. In the sphere of education, how can this be addressed?
Sorry?
How can the difficulty of making sure everybody has access to a screen, how can this be overcome? Because some people have a computer and some people do not.
Yeah. And that was one of the things that was underlined during the focus group, because, for example, the art teacher said, I know one woman, one mother that became mad. She had to go to the doctor because she was not able, she had not the devices, the useful devices for distant learning in the house. She had not connection, and she was not able herself to follow the students. Sometimes also we found out that the family's middle the healthy families could, and people who are trained in technologies could follow the students in the family better than other who had no these opportunities. So you You must have competencies, you must have devices, you must have a connection that does not fall down at any time. Or sometimes the family, we found out in the focus group that many families had a mobile, but they don't have a smartphone, but they don't have a computer. Or sometimes when there was a computer in the house, if you have 3 or 4 children that they must follow the distance learning, you cannot follow. So I don't want to seem too optimistic. I'm optimistic in the sense that when I had to work hard for distance learning, I found a lot of resistance, and now I said maybe now we can understand more, but this does not mean that is the solution of teaching and learning. We can continue in a parallel way. We can integrate the two things can be can be put together, but they must not. One must not cancel the other. Otherwise, there are absolutely very big problems. And we found out as in the survey of the national agency, that the 10% of students disappeared. That means that they were not trained at all. So this is a big problem. And the national plan, as I told you, began in 2016 and is lasting in 2020. But it was a slow process. We cannot tell that every school in Italy is now connected at all. And I think the next step of the government within the EU plans is to take in consideration the problems of families and of people who could not follow distance learning, and we'll try to do something to arrive to a more equal to give more equal opportunities to everybody.
Thank you. Well, we're almost out of time, but I know that many of our audience will be very, very interested in the relationship between policy and the research that you're doing. But as we only have 2 minutes left, could you very briefly say how your work will potentially influence policy? I'm thinking of the work of Chiara and Vanessa, of course, because I think to some extent Giovanna is making the policy. But anyway, we can find that out. But how will that work out?
Sorry, can you repeat it?
I was just asking Vanessa and Chiara how their work relates to the creation of policy.
So you asked to me or Chiara? I don't understand.
To Chiara and Vanessa.
Ah, okay.
Thank you. Yes, absolutely. Now there are ways for us to progress at policy level. I think in particular connecting with our contacts within sort of the medical world, the world of practitioners. But we feel like the research we did was very qualitative, was very much exploratory. So ideally, it would require a bit more of a more data collection, but also just trying to connect with other people who are doing similar research at national and then international level. That would be probably the best way forward. But I think there has been, for what I understand, among clinical and medical practitioners, this idea that something has to change. And as I said, assistance and care has to be moved to the home in particular. And this first lockdown, I think the country was completely taken unprepared by surprise. And I think this knee-jerk reaction, it's been acknowledged that was just, it's just not good enough in particular, because there was such a problem of assistance of so many people at home, and for chronic illnesses in particular, and other patients, vulnerable patients. And in the case of maternity care, hopefully, but as Chiara as well was pointing out in her part of the paper and in her research, I mean, the medicalized sort of culture in maternity care in Italy is very much ingrained, and it would request, and the structural inequities between regions as well. So you just do not have the smaller clinics or in southern regions that could be providing alternative community care, more humane type of, for example, birth. You would need a huge shift, and even the women who were scared of giving birth were still ready to face that instead of opting for home birth, because home birth was still an option in the country, in Italy. But this is just so not at all cultural. You can really see a shift in the difference of attitude. So who knows how much.
That's absolutely fascinating.
The
I'm sorry we're out of time now, but you see, our discussion could continue for a long time, but thank you so much. We've learned an enormous amount. It's a really great pleasure to be able to have you with us. And all we can do is say thank you very much, and say, well, good night, I guess.
Thank you.
So thank you.
Thank you. Thank you.
Bye, thank you.
Bye. Bye.
Bye.
Bye. Bye. Bye.
Thank you.